All right, guys. I don't know if you can see this bump right here, right? That's a third degree type 3 AC joint separation. I fell in a motorcycle accident. I didn't do this at the gym or anything like that, bench pressing or lifting heavy. Motorcycle accident, fell hard on my shoulder, separated. I'll show you an image so you can take a look at the imaging of the injury. And in this video, I'm going to show you how I still, till this day, lift heavy weights. I still bench press. I still shoulder press. I still overhead press. Nothing has changed really in my workouts except maybe one or two exercises that I avoid completely simply because it doesn't feel right. It feels very uncomfortable. But other than that, I haven't really changed much. And I'll show you the exercises that worked for me to prevent surgery because I've never had a surgery done on this. And these exercises are something that has just became a staple now in my workouts. I do them before every upper body slash shoulder workout. And I do think it will help if you have any type of injury when it comes to shoulders. Because as you know, I don't need to tell you this, but when you have a shoulder injury, it's so like discouraging and it's nagging and it's like takes forever to go away. And it's one of those things where it's like soul crushing, especially if you have the motivation and you're ready to go, and then you do something and it's like, it hurts, and then and then that lingers, right, for days, weeks, months, and if you don't rehab it properly, if you don't do all the things that are boring but work, it's gonna take forever to heal, if anything, if it ever does heal, right? Uh, So yeah, so let's hit the gym. Let me show you the exercise that I do. We'll come back here. We'll chat a little bit about what happened, how it happened, and how I live with this basically injury throughout my day to day. So shoulders, right? Very important to warm them up. First exercise, you probably have seen it before, but let's demonstrate it properly. You want the cable to be about mid-height here. Your hand is 90 degrees straight, like this. Not like this, not like this, like this. You're gonna hold it. You're gonna keep tension on the cable the entire time. Take a mini step laterally. Out. Keep the tension. Do not let it hit. Keep the tension. Okay? The weight should not be heavy. This is at the lowest that it is, maybe 4 pounds. Now, keep in mind, the towel, there's a trick that you want to keep the elbow in. You can roll a towel, hold it, and make sure that it doesn't fall. So what you would do is you would put the towel against you and you would squeeze it and not let it fall, okay? All right, exercise number 2. Again, very important. Grab a light band. It has to be light. The tension can't be too much. You're gonna attach it to either the pole, anything really that's steady, okay? You're gonna hold it, palm facing down, 90 degrees. Now, very important, you're not jacked up like this. Shoulders are down and back, 90 degrees. And all you're doing, driving your elbow forward as you rotate back with the palm. Just like this. Okay? You're not swaying, you're not turning. It's locked in, 90 degrees. Just like that. We're rotating, guys, rotating. And that's gonna work on the rotator cuff, stabilize all the muscles around it. So when you're ready to lift, everything is firing and supporting your rear delts and supporting your movements throughout your workout. All right, so for the next exercise, all you need is like either 2 to 5 pounds or body weight, meaning nothing. You're gonna set up a bench, okay? Slight angle. What you're gonna do, you're gonna come on here, flat. Your legs nice and stable. Thumbs up, rotate up, pause, come back down. Just like that. The head is neutral, the thumbs are facing up, nice and controlled. Now,
keep in mind, when you're getting to the top of the range, you're shaped like a Y. Not a T, not a V, a Y. Okay, keep in mind. Your shoulders are back, contracted. The tension is gonna go from rear delts, a little bit of traps, okay? And as you come down, you wanna make sure that you're relaxing your shoulders back and you're not shrugging, okay? I would do about 2 sets, anywhere from 12 to 15 reps, nice and controlled. Same thing for the cable, same thing for the band. The last one, pretty straightforward. Again, use a light weight, okay? Light weight. I have 5 pounds here, it's not too heavy. I can maybe do 10, just make sure that you're doing something that's not putting strain on your shoulder and pain-free. So we're gonna mimic what we did earlier with the cable. What we're looking for is tension right up here in this range. All right, facing forward. Elbow on the pad. Rotate up as far back as possible. Feel a little stretch. Again, no pain. And then bring it back. Nice and controlled. Feel the stretch. And bring it back. For this one here, anywhere from 8 to 10 is plenty. You want to make sure that the rotator cuff is nice and stable. This is a good way to strengthen that. And also the range of motion is going to be better with time. Okay guys? We're not yanking it, you're not moving, you're not laying flat. You're staying straight and controlling it the whole time. Okay? Give that a try.
All right, guys. So the most common question I get is, did you need surgery? Now, yes and no. And what happened was, when the doctor took a look at it and took a look at the x-rays and the imaging, he was saying, like, listen, technically we probably need to get surgery done to put it back into place, right? But when they did mobility testing and strength testing, they noticed that because my strength was pretty high, my mobility was pretty good, that they rather avoid opening me up for whatever reason. And I agree. If you can avoid going under the knife for any reason, I would avoid it. If you can do anything organically or naturally or holistically, I would do it if the results are better, if that makes sense. To cut me up, put a plate in, screw it in, the risk reward just didn't make sense for me. So I'm just living my life now. It does, surprisingly, you'd be surprised, it doesn't bother me at all. I don't feel it ever. Maybe down the road it's a different story. We'll see. I'm not there yet, and I'll deal with that when the time comes. But I do think that having a routine when it comes to my rehab, and I call it rehab just because, there's no recurring injury. It's just, I like to say rehab, right? It just helps make me feel like I need to do it versus a warm up. I can skip a warm up, but rehab it sounds more important, So that's just me talking to myself in my own head to justify why I need to do this, right? So I guess that's a me problem. But having said that, I do think it's very important to understand how your body feels. And listen, if you require any type of surgery, get it done. Like I've done, my knee surgeries, have ACL tears and stuff like that, playing sports. But my point is, if I could avoid it and the healing process would be just as good, I'll avoid it any day of the week. Now, I'll tell you what I did when it happened. Okay. I was on my motorcycle. I fell. The bike fell on me, separated my shoulder. I attacked the rehab literally the very next day. The very next day. I was in a sling, but I did what I could in a sense of rest, ice, take anything that's anti-inflammatory, right? Drinking a lot of water, staying hydrated, heat, ice, rotating, alternating in between, right? And then as soon as I could start moving my shoulder in any way possible, I went to physio and started right away. Now, guys, I do want to say my background is in physio and personal training. So I am aware of the exercise that I need to do. And I guess I have a lot of knowledge in that field. So it wasn't an issue there. But when it's happening to you and you have to do it, it's different. It's different. It's not the same as you going to someone and doing it. You have to be self motivated, and I have to put myself through the range of motion. It hurts, and you got to push through it. It was hard, but doing aggressive rehab when it comes to massage therapy, fascial stretch therapy, blading, cupping, dry needling, what else? Muscle stimulation, like all that stuff. I just attacked it, right? And that helped a lot. That helped a lot. Now, did I skip gym days? Sure, a few here and there, but I was going to the gym. I was doing legs. I was doing what I can. Is my point. Did it stop me? No, it won't. That's just how I'm built, I guess. But all this to say, if you're dealing with any nagging injury, the most important thing I'll tell you is patience. Do not rush the process. Okay, I've done that mistake by rushing things when it comes to getting back into the gym as soon as possible, and understand that you will you will get back to where you were most likely if you're patient and take your time. But it might take a lot of time. That's all. Okay, you're not going to be there tomorrow or 2 months, but it took me about 6 months after for me to start benching again. Do I bench all the time? No. Is benching something that I recommend? Probably not. It's I don't think there's a point to it unless you're doing some type of performance, right? But for aesthetic, if you're trying to look a certain way, there's no need to bench press, really, to be honest. There's other exercises that you can do that are safer, simply because when the bar is locked in and you're pushing, you can't really control how your shoulder sits naturally, and that may cause a few issues and it might feel uncomfortable. That's why a lot of people get bicep tendon issues, or just shoulder impingement, or any type of weird things going on, simply because the foundation of their lift is not properly set. Okay. Now, having said that, I recommend picking a few exercises if you have any shoulders issue. This is not medical advice. Obviously, go see your physician, your physiotherapist, your trainer, whoever's handling your care. Um, and if not, there's a gazillion YouTube videos that you can watch, I'm sure. But all this to say, guys, the older you get, take your time when you're injured, do the rehab. It's just as important as anything else. But take care of your body, eat properly, drink, hydrate, and you'll be okay. I would love to hear from you guys. Let me know in the comments. Are you dealing with anything? Any type of injury of any kind? It doesn't have to be just shoulder related. But yeah, let me know. We'll start a conversation, and I'll see you on the next video. Take care.